So good afternoon, everyone. Apologies for the 5-minute delay. I'm just giving you a chance to get some cookies. So if you could take a seat, please, and we will get the show underway. So welcome to Hot Talks 2017, a spotlight on young carers. Welcome to all of you in the room, and also welcome to the 100 or so individuals that are joining us through a webcast today. So this is actually our second Hot Talk event that focuses on caregivers, and it actually falls on National Child Day. So it's very appropriate then for us to be shining a light on the often invisible population of young carers. Family caregivers in general are a group of people that the Change Foundation has been working with quite extensively since 2015. And shortly after we started our engagement work, one of our partners from the HNHB, Lynn, suggested that we meet with Powerhouse, a group in that region that supports young carers. It was the first we had heard of young carers, but as soon as we learned more, we knew we wanted to help bring attention to their issues. So we've been listening to and learning from young carers and the providers that work with them for the past year and a half. We've also tried to identify other organizations in Ontario that are working with young carers, and to date we have identified 9. And they are described in an inventory document that is available both on our website and at the registration table that looks like this. We think these are the 10 organizations that are in this sector, and they're extremely important to us. Today's Hot Talk event is the first of 2 that we're actually hosting this week. Tomorrow, we will have 90 people, including 20 young carers from across Ontario, who are coming together to roll up their sleeves and talk about how to collaborate to make meaningful change for young carers in Ontario. And today, we have a wonderful panel discussion with 3 caregiver experts. But before I go into the agenda, I just want to run through a couple of logistics. There is a coat room here if you want one. The washrooms are outside and to the left of the main door. Following the discussion, we will be hosting a reception in the area through which you came, so hopefully you can stay and join us for that for a little while, and we promise to feed you more food. And we will be tweeting throughout the event. Please feel free to do so as well, and use the hashtag HotTalks2017. The live webcast that we are recording now will be available up on our website by the end of the week. So, in terms of the agenda, it is up on your screen. There are 3 people that you're going to hear from today, and their bios are in your package, so I'm not going to read them out. You can read them at your leisure. But know that they all bring significant experience and wisdom to the discussion today. First, we're going to watch a video from Abbigail. Abbigail is a young carer from the Niagara area who looks after her twin brother, Andrew. Abigail and her family have agreed to share their story today, and Abigail will talk a little bit about her own experience. Following the video, I will have a chance to just ask her a couple of questions, and we'll get to know her a little better. Then we will hear from Jenny Frank, who brings over 20 years of experience working with young carers in England and further abroad, and she's currently in Canada and in Toronto in particular, working with Hospice Toronto. Jenny will focus on programs and supports for young carers in the UK. And then we will hear from Janet Bede, who is likely known to many of you as she recently helped the Ontario government shape plans for a provincial caregiver organization. Janet will give us some insight on the current thinking for the creation of that organization. And then following the presentations, we will open up the discussion to audience questions. So that's the plan. Let's get started, and let's hear Abigail's video. Thank you.
My name is Abigail and I am 14 years old. I am in grade 9 and I'm a young carer. I love using my telescope to look at stars, planets, and anything else I can see in space. I also like to draw and to help others. Can I have leaves in your face?
Or
Okay. Okay, you're mean.
what the? Yeah.
Are you getting a spice latte?
I don't know.
Spice latte? They're disgusting, don't get it. My twin brother is the reason I am a caregiver. He was diagnosed with Tourette's at 5 and a mood disorder at 13. You should get a hot chocolate.
I don't want a hot chocolate.
A day in the life with Andrew can be a great day or horrible. He could be angry, happy, or sad all day. Do you like it? Being a young carer impacts everything in my life. My social life, school life, and family life. We have to go to different high schools because he was obsessed with what I was doing. I also have to explain what is going on with Andrew to schools, counselors, and peers. It affects my friendships because they don't understand the way Andrew acts. During the times that Andrew didn't have support, I had to step up to do more cleaning around the house and helping my parents keep Andrew busy so they can have some time to themselves. I also help remind Andrew to take his medication and to make sure he takes it. He used to have bottles of medication, but it was hard to know if he took it or not. Now we have a blister pack for the week, so it's easier to tell. Andrew has been seeing the same doctor since he was 5, and the doctor has helped a lot with his diagnosis and giving us tips on how to deal with it.
Hi, it's Stephanie calling. I'm wondering if I can get an appointment for Andrew with...
When my mom has to make an appointment, wait times can be as long as 6 months. Andrew started at Pathstone Mental Health School in grade 4 and has been in and out of their program since then. For a limited time, we had a counselor who helped our family a lot with information and how to help Andrew. I also just spend time sitting with my mom when things are rough. Being a young carer can make you feel anxious, depressed, and a whole bunch of other emotions. It makes me feel stressed and anxious when I think about how he's doing when I'm not with him. It also affected my schoolwork and grades in elementary school. Some people still talk bad about him, and it makes me upset. People don't understand what other people could be going through in life. Powerhouse is one of the only organizations in Ontario that supports young carers. I have been going to Powerhouse since I was 8. It is the only place I can go to express my feelings without people judging me. At Powerhouse, kids listen to each other, we go through similar things, and learn more about how to deal with distress at home and at school. I want to spread awareness for young carers, the challenges they face, and the support they need. I want to see mental health as a priority for youth with complicated mental disorders. Just being different doesn't make you not normal. There is no such thing as normal. As a young carer, I want to see my needs included in policy so more supports and resources could be available to help make my life so much easier. My name is Abigail and I am a young carer, but that's not the only thing I am.
So this is Abigail, and we want to thank her, and we also want to thank Stephanie, her mom, who is here today, for the story that they've agreed to share with us. So Abigail, I'm just going to ask you a few questions, and we'll see how this conversation goes, okay? Okay. So recently, some of you may have seen there was an article in the Globe and Mail that actually featured Abigail and Andrew and a number of other young carers in the room. So we were just wondering what's actually happened to you since the article was published. Okay. Yeah, no, it's okay. Just lean forward a tiny. That's it.
Is that working?
Yep.
A lot of exciting things have happened since the article came out. My school hung the article in the hallway, and a whole bunch of kids that I've never met before came up to me and said hi. There was this school art club I wanted to join, but it was after school, and due to my caregiving responsibilities at home, I could not go. So once my art teacher read about it, she invited me to join the one on Friday at lunchtime. So that made me very happy. The story and what has happened since is one reason why caregivers need more recognition and awareness across Ontario.
So when that happened at your school, Abigail, how did that make you feel?
It made me feel very happy.
Good.
And
And maybe a little proud?
yeah.
Yeah. So, see all these faces out here? Some of them, actually, none of them have hair as cool as yours, but a number of them work in government, or they work in the healthcare system, which is a system we try to influence. What do you want them to know about young carers, and what do you think they can do to support young carers?
What I want them to know about young carers is that it's part of who I am. There can be good times and bad times. It's hard to make friends and spend quality time with your family and go out with them due to the issues at home. Young carers need to feel more comfortable and respected while talking to healthcare professionals. Powerhouse is one of the only organizations that in Ontario that young carers can go and talk about their emotional and mental health and get away and relax with friends. Powerhouse is part of my family's healthcare team, and young carers deserve a place like that.
Great. Now, what advice do you think you might have for other young carers?
The advice I have is to not be ashamed of talking to people about your life. Talk to the people you trust. Do things you like to keep your self-esteem up. Stay true to yourself and don't let others bring you down.
Amazing advice. Thank you. So we obviously worked with Abigail on this script. Those are all her words, and we rehearsed it because she was a little worried she might forget something, and she forgot nothing. So thank you, Abigail. Now I'd like to ask Jenny Frank to come to the podium, please, and deliver our keynote address. Jenny.
Thank you. Okay, thank you, Abigail. Hard act to follow, but I'll do my best. If I can get the mic working. Okay. So, I wanted to just start by saying thank you to the Change Foundation for inviting me to speak today. It's a great privilege. Great to be seeing so many people here. And I would just like to say I know there are other young carers and their families in the audience. So it's good to know that you're here because you are the experts in your own lives. So listening to myself and other professionals is only half of the story. That's why Abigail's story is so powerful. So I've been working in England in the field of young carers for over 20 years in the not-for-profit sector to raise awareness of the needs and issues of young carers, to promote change at both policy level, but also to improve direct support for young carers and their families. Shared our learning internationally, and I've been involved with the developments in Canada for many years, Firstly, quite a long time ago with Powerhouse, in the very early days of their awareness raising, and then for the last decade, linking with and supporting the development of an exciting young carers programme at Hospice Toronto. And it's just exciting to be back here at such a time of synergy and opportunity so that we can all work together for the benefit of young carers in Ontario. But today, I'm here to share our journey that we took in England and to recognise, reach out and support young carers of all ages. It's been a long journey. It's been over 20 years. We still haven't got it right, but I feel that we've made some groundbreaking changes which I wanted to share with you. Our journey's been all about the children and young people and their families and listening to them, listening to their needs, understanding their strengths and their aspirations, and then taking their views forward, both in research and campaigning for policy change, but also improved recognition and support. One young man said to me many years ago, he said, "Jenny, I won't know that it's changed until things have changed in my own family home." And that's a challenge for us. Policy, practice, it can all be put out there in place. But until we've made a difference in those family homes, then we still haven't got it quite right. So, our original research started in the 1990s. There were a number of researchers at that time, including Professor Saul Becker, that many of you will know, Professor Joe Aldridge, Sandra Billsborough, and also myself. We published findings after meeting and listening to young carers. And that started the ball rolling way back in the 1990s. First piece of work that I did was looking at the needs of sibling young carers. But very quickly we realised that there were also children caring for parents, for mums and dads and grandparents. And so the work started to broaden out. Although I'm officially retired now, well, trying to be, not quite working out, I worked for the Children's Society for 22 years, and together with another major organisation in the UK, Carers Trust and the YMCA, we fostered a united voice for young carers. So I'm particularly delighted to hear today start with the voice of young people, because they're the ones that we need to be listening to. Okay. Who are young carers? So in England we have a definition. We worked long and hard to get this together, and it's basically children and young people under 18 who provide or intend to provide care for another person who has a long-term illness, is disabled, has a mental health condition or addiction problem. They could be caring for parents, sibling or other family member. We have a legal definition in England, and it is very tight. It stays to family members, although I know that some young carers do care for others that are not family members. And young carers often take on that practical support that we would normally anticipate that an adult would undertake. I think it's very important to remind ourselves that it doesn't just happen. Young carers don't just care in isolation. They're providing care in their family because somebody in their family may have an unrecognised need if they're not getting support, or if it has been recognised, maybe they're not getting the support that they really need in their family home. And I will come back to that later in our journey. So young carers in age 16 to 25 are also recognised in the UK, partly because they asked. So our young carers projects for many years stopped when they reached the age of 17. Once they were 18, they were too old to use the services. It's time when a young person really needs a safety net, starting a career, wanting to go on to further education, wanting to leave home. And so we worked with them so that there could be support for them. And when I talk about the legislation in a minute, you will see that their needs are included in that as well. So here I am talking about young carers. And Abigail said at the end of her film, something that we need to hold on to. I am a young carer, but that's not all that I am. I hope I've quoted you correctly. And we need to remind ourselves that young carers are children and young people first, and they have the same rights as all children and need to be offered the same opportunities, and that the impact of caring shouldn't prevent them from having a childhood and achieving their own personal goals in life. So everyone cares to a certain level in the family environment, but when that level of caring starts to impact on a child's own well-being and progress, then we need to think what needs to be in place. And we need to be asking ourselves a simple question: why are they caring at such a level that it's impacting on them, and what needs to change? So there's all sorts of things that young carers undertake: the practical caring around the house, the housework, maybe helping with washing and dressing, watching out for child's safety, giving medication. The list is really quite extensive, and that can be some young carers as young as 5, 6, 7, 8 in the UK. But the biggest thing that the young carers tell us, and the other issue as well in the UK for us, and I'm wondering if it's the same in Ontario, is that a lot of the young people where English is not the first language for their parents actually end up translating quite complex clinical and social care letters for their families. But the key thing for all young carers that I work with and talk with is that they always say it's not what we do, it's the emotions and the feelings and the emotional support and that we feel inside us that is the hardest to deal with. Okay, so how do you know if I'm a young carer? They don't walk around with labels on their heads. They're children and young people in all walks of life, in families, in all parts of the country, all sorts of socio-economic strands. Illness and disability can strike us no matter where we live. But we found that there were many reasons why these young people were hidden. So often it was falling into the role gradually. So maybe if you're caring for a brother or sister, as that brother or sister gets older, the caring responsibilities become heavier and more demanding. Or if it's a parent that you're caring for with a physical illness or a mental illness, that illness, the caring may be quite gradual to begin with, but then it increases. And by the time that you realise how much caring your child is doing, you're often quite worried about asking for help. So often families don't seek the help they need until a crisis is reached and they remain hidden. Lots of other reasons. Maybe there's not good enough information out there. We've tried to change that in England, making sure that it's safe for families and young people to come forward. And you'll notice that I keep saying families because this is about families. It's not just about the children themselves. In England, I'm sort of familiar with the system in Canada, but not as much as I should be. But in England, we have separate departments for adults, healthcare and disability services. And we then have a separate department for children's social welfare and education. Huge gap in services, different budgets, different protocols. And when they don't work together and talk together, it was the young carers that just slid right through the gap. For quite a while, we had a campaigning programme called Mind the Gap, because we felt these children were falling between these two gaps. Our legislation has now closed that gap, but we still have a way to go. So the other reason, I should say, why children and young people are hidden is that they often don't realise that they are a young carer. It's just part of life, it's what I do, I get on and do it. And so they don't realise that they might be entitled to a voice or help. So the impacts. So caring at any age can be really daunting, quite traumatic, and can be difficult to cope with. So for young children and young people under the age of 18, coming to terms with some of the caring responsibilities and the feelings that they have can be really quite overwhelming. So research published by the Children's Society in a document called Hidden from View, collated massive longitudinal data from the Department of Education and confirmed that excessive and inappropriate caring can affect a person's physical health, emotional well-being, education, and then in turn, their life chances. So I just want to take a moment here to just share with you what is inappropriate caring. For many years, people would ask, so when is it okay for a child to care? Is it 8, 9, 10, 13, 14, 15? Is it okay for a boy to care for mum or girl to be caring for dad? And all the cross-gender caring issues. Is it okay for an 8-year-old to do the ironing? Or maybe it's okay for them to do the ironing when they're 13. But actually, it's about the child. It's about assessing how the child is coping and how it's affecting them. And if it's affecting them in any way in their well-being or their educational opportunities, then in England we consider that it's inappropriate. And we try to step in to help not just the young carer, but to see why are they caring and what is needed to make a change for this family. So it's very child-focused. And I have to say that I feel we took a lot of years trying to work out what the right age was for a young carer. And the truth is that if it's impacting on them, there is no right age. So some of the impacts that the young people tell us is a bit echoing what Abigail said. Not much time for yourself, not much time to have your friends home around, and also feeling that they're invisible. Interesting to hear Abigail say that one of the wishes that she wanted was for health to listen to her what was needed. A lot of our young carers in England said, well, I'm invisible. Professionals come into the family home. It must be obvious that they can see what I'm doing, but they don't ask me how I'm coping, what I'm doing and what I need. So the impacts for them can be quite enormous. Impacts on school and attending school, and even when the young carers are in school, often they might not be concentrating because they're worrying about the person at home. So even more hidden and impacted are those children who may be caring for a parent with mental ill health. So in England, around 1/3 of the young carers that we've now identified are caring for someone with a mental health condition. And historically, many of those young people have gone totally unidentified and totally unsupported. And as you can imagine, the emotional care and support that is given by these children is sometimes quite enormous. I have to say at this point that just as in families where there are physical disabilities and illness, not all children whose family members have a mental ill health or a physical disability will experience difficulties or be young carers, and taking you back to what becomes inappropriate and how it impacts on that particular child. So by no means is it the same for all families. So children caring for a parent with mental ill health can feel a huge sense of responsibility, and this is mirrored where there's physical disability and illness as well. Huge loyalty to their parent, and some go to great lengths to conceal the illness and its effects, to make up excuses for their parents' or their brothers' or sisters' behaviour, but also to make up excuses for why they might be late at school that day. They're not going to say I was late for school because I had to make sure that Dad took his medication, or I had to make sure that Mum was out of bed and had got dressed, and the care support had arrived on time. They're just really going to shrug their shoulders and say, well, I'm late, so what? And so they remain to be hidden. Young carers also may find it hard to understand the illness, and to be fair to them, we need to think in a family situation, how do we explain to them in an age-appropriate way? Illness and ill health is part of life. It can affect any of us, wherever we are. We're not very good at explaining what it means, and we're certainly not very good at explaining to children and young people in ways that they can understand. And often just doing that can really help alleviate some of the anxiety and the worry that the young person might have. We're aware also there's dual diagnosis, so some children may be caring for parents that have a mental health condition may also be affected by substance misuse, alcohol dependency. Very important for all agencies that are engaged with those families to work together, talk together, and offer joined up support for those families. In England now, we have developed several protocols, and I'll touch on them later, for services to recognise and support these families and to share information. I think anybody that's been touched by illness in whatever way will know how difficult it is to explain to the doctor what's wrong with you, and then have to explain to a nurse, and then maybe you have to explain to a social worker, and then the next time you go back, you might see a different doctor and you have to start again. So it's very important to make sure that there are systems in there to share information so that people don't have to keep telling their stories. So research also found out in England that where children are caring for a relative with drug or alcohol problems, alcohol dependency in England being one of the most hidden areas of young caring, that the incidence of missed school and educational difficulties were considerably higher than for other young carers. Also there were indicators of other educational difficulties, so not attaining, not achieving. And also the difficulties of caring for a parent or a family member who's affected by substance and alcohol misuse is sometimes the confusion about why the parent is behaving this way. And I think it's very important that the young person is helped to recognise that it's not their fault. So they mustn't feel that in some way that they're responsible for this. So many, like this group, like all young carers, this group needs someone to talk to and for their needs to be understood. And in England, we developed a support system called Parents Using Drugs, which is an online-based system, but also we used to go out and train alcohol dependency teams and drug teams to actually recognise and support young carers because we felt they were so hidden. Throughout this, everywhere, not just for mental health, alcohol, drug dependency, early intervention is the key. So making sure that young carers and their families know where they can go to ask for help before they reach crisis point. I think I'm on the next slide now. So, I feel I'm being a little gloomy here. But I think we need to face the reality that some of is real everyday reality for some of these young people. But I just want to say, and my husband's in the audience and he will know this, that the reason that I went to work each day for the last 20 years was because working with these young people is an enormous privilege, as I think those of you in the room that are working with them, to witness the challenges that they faced and the love that they gave to their families and the determination and resilience that many of them show is just so powerful, and I think we owe it to them to make a change. In England, we recognise that young carers can develop resilience. They can appear much older for the years, and they can also have many transferable skills. They are empathetic, they are caring, and caring can be the key skill that they are proud of. They feel good at it, and they feel very proud. Often these skills go unrecognised, and we didn't have a way of accrediting this in England. So young carers that might have been failing at their exams but were actually had transferable skills, they weren't being recognised. I will touch on how we now recognise that later. Alongside the resilience, underneath that all could also be vulnerability. Conflict of emotions, loving the person that you care for, but maybe not quite understanding what the condition is and why it's impacting so on your family, may feel unable to ask for help. And that caring may be the key skill that they are proud of. And no, I haven't repeated myself by mistake. I've done it deliberately. Because if caring is the key skill that they are proud of, and that shows up in an assessment, unless we're very careful, we might say, that's okay then, that's really good. You're coping, you're doing really well, what a good job. And then neglect to put further support in the family home. Very important. So it's not to undermine the pride that these young people feel, because it's very real, and there's no reason why they can't continue to feel proud to give and love at a level that's not impacting on their own well-being. And I think this is the balance that we need to be careful of. So, young carers aren't born with extra abilities. They're no different to anybody else. They tell us we just learn to cope because we have to. They just get on and do it. But when do we need to say, actually, that's enough? Your family needs extra support. You need extra support. What can we do to change things for you? So I'm just going to talk through 20 years of my life in one slide, a couple of slides, to share with you some of the learning that we undertook in England. Just to be clear, young carers are defined in law across the whole of UK, but the legislation to provide support only changed in England because we are 4 nations and there are 4 legislative processes. So I just wanted to make that clear. It's not the whole of the UK that I'm now talking about, it's England. So, long journey of raising awareness. One of the key things that we formed and really, really made a difference, and I think you may have the start of it here today, is that we had lots of not-for-profit sector working with young carers projects. I think at one point we had 300 young carers projects across England and the wider UK, all doing excellent work, but all at a local basis. Some of them were run by Barnardo's, the Children's Society Action for Children. Some of them were just independently funded. All giving messages, maybe not all quite the same message. So we formed a coalition of the major providers. We came together and we agreed that although we were chasing the same pots of funding, that we should put that to one side and that we should agree core policy changes that we wanted to see for these young people and core messages for the media. Using the media is amazing, it makes a difference, but we need to make sure that the media get the messages right for these young people. And this was a turning point for us, forming a coalition, because if we wanted to write to a minister, instead of a minister getting one letter from one organisation one week and another the next week, and it might be handled by a different team, they would get one letter with 15 signatures from 15 chief executives, all saying that they wanted the same change. And it really, really did make a difference. So the other, this all came together. I was talking to Janet earlier about opportunities, and I think we were very lucky in the opportunities. There was a window of opportunity that just kind of opened, and everything came together at the same time. In 2007, the Standing Commission on Carers was set up, and I was lucky enough to be invited to sit on it. It was formed of members who were all carers, but also had professional expertise as well. And our role was to inform government and the Prime Minister to see what the challenges and the opportunities were to set up systems for carers across the board, and that included young carers. And this started the journey to changing the legislation, which was changed in 2014. So we had the coalition, we had the Standing Commission, and then we had making a step change. This was where we felt we needed to make a cultural shift in the way we thought about young carers. So we'd been providing young carers projects, which were excellent. They were giving support to the young people, which young people find so valuable. They had a chance for someone to listen to them. They had time to be a child. But then they would go home and nothing had changed. They were still caring for their family member because we'd looked at the giving them a break, but we hadn't looked at the cause and the reasons. So we applied for funding to our Department for Education. We ended up with, I think, nearly 4 or 5 years funding, which enabled us to roll out training and development across the whole of England. lived in a lot of hotels. And we trained a lot of social workers, public health nurses, schools. We went out there. We took young people with us, not personally because they needed their education, but they made films just like the one that Abigail's made. And we went out there and we trained the practitioners. So that was kind of setting the scene for change. And it was called Making a Step Change because we were using the wording, why are they caring and what needs to change so that they don't have to care at levels that are impacting on them. We can't just provide a break. We need to think what needs to change in the family home. And out of that was born a whole family approach model, which I will talk about in a minute. So we were doing that. So that was part of the equation, training the professionals. We then needed to make sure that we had the young people's voices on board. In the year 2000, we thought, young people said to us, I was running the Winchester Young Carers Project at the time. They said, we would like to know if young carers in Yorkshire or Cornwall or London have the same issues and needs. Can we all get together? So together with the YMCA, we started the very first Young Carers Festival. We had 600 people there the first weekend. It's now just had its 18th birthday. I have to get this right. Yes, am I right? 18? Yes, doesn't sync with the years, you see. 18th birthday. And we have 1,500 people there every weekend, camping, having fun, chilling out, new skills. But also, throughout that time, they have a voice. And we do it in all sorts of interactive ways. So simple ways of just having a wish wall about what they want to change. They have their own radio station, which they can go and interview people. They have phone-ins from politicians and policymakers. And we also invite policymakers to come to the festival. And without a shadow of a doubt, they all say it's the scariest thing they've ever been to be faced by a room full of young people asking them questions. So they come, but it's really worked. And that, together with the coalition and the commission, helped influence change. So you can see how this drive. So we even had the BBC turn up at Young Carers Festival and actually run their morning politics show on the left out of the festival in the morning. And here, for those of you who are familiar with BBC, we have a flagship radio programme which is very political called BBC Question Time. And that's question time in the sports hall at the festival. But what was important was for the first time in the history of question time, a young person got to ask a question. Never before had it happened. So, you know, really, really powerful that these young people had a voice. Then, luckily as well, another piece of luck, we got funding from the lottery. Watching my time here. How much time have I got left? 3 minutes. Ooh, a gallop. Okay. Right, I'll do my best. So we set up something, we have 5 years funding called Young Carers in Focus. And we trained 200 champions across England, young carer champions. We gave them skills which we accredited. You remember earlier I said, how can you accredit these transferable skills? So we trained these young people to go and talk to politicians locally and nationally. And we also set up their own safe internet where they could share films that they had made and they could talk to each other where it was moderated. They created their own tools and resources, and out of that grew another programme. Oh, I need to quickly talk about the legislation. At this point in 2014, in the middle of all this funding, the law was changed. Sounds easy, wasn't. The landmark change in legislation took a lot of lobbying. So you remember I said that there was adult services and children's services? We had two pieces of legislation. One for changing social care, which was for adults, and one for changes to the Children's Act for children. And as they were going through drafting, they were saying slightly different things. So we worked long and hard to get two sides of the mirror. So it now says that no matter what door the child or the family goes in, whether it's adult services for help or children's services for help, they will get a whole family assessment for their needs. So why is this child caring? What does the family need? What needs to change? And what can we put in place to make a difference for this child and their family? I can talk about that later as well, because it sounds so easy, but it was a 7-year journey to get that law changed. Out of that, afterwards, young people from the Young Carers in Focus programme said, well, the key things are, school doesn't understand my life. I don't want school to know I'm a young carer. How can teachers be able to support these young people when those feelings are going around in their head? Because school is somewhere where they want to go to get away from life and also not to be seen as different. But they also want school to support them so they can achieve and understand. So we set up a Young Carers in Schools award, guided by the young people. They monitor it, and they have the final say on the schools that get the gold award. There's bronze and silver. There's so many schools that we have to moderate the gold and silver, the silver and bronze. But when a school reaches the stage for gold, it's the young people that have the say. To our delight, that's now recognised by the Schools Inspectorate in UK, the Gold Award. So it's made a huge difference. The other thing that the young people asked for was for health. I will finish as quickly as I can. Is for health, who are key. So for GPs and health agencies to understand. So we ensured that the young people could meet with the chief executive of the NHS, and he put some money in place. So we and the young people then went out to train school nurses, public officials, GPs, and health are now very engaged and recognise the needs of young carers. So you can see how this has evolved into a journey. And then last but not least, almost last, the importance of local young carers projects. Many of you are here today. So still, no matter if there's support in the whole family, it's so important that young people like Abigail have somewhere to go to where they feel safe to talk. So alongside of all of this, it's just so important to continue to have young carers projects and young carers support in whatever shape or form meets the local need. So the last thing that we did just before I retired was the young people said they wanted to get messages out to the general public. And so we put on an exhibition called Hidden, a series of portraits portraying the children in a way that they wanted to be portrayed, just as I am. Max Alexander, the photographer who took them, is here with us today. And this went beyond all our expectations in raising public awareness and generating media. You would have thought job done when we changed the law, but it wasn't. We still needed to reach out. And this exhibition has toured around the whole of England for the last 3 years and will be finishing in December in the House of Lords, and has empowered these young people to have their say in all the corners of England. And what I'm really pleased about is that some of you know already that Hospice Toronto have gained funding and have got funding in order to roll this out across Ontario. And Dina Moore, Chief Exec, is here today, so I'm not going to steal her thunder, but if you want to know more, I'm sure she'll share it with you. So I just wanted to finish with some key messages to take forward for Ontario, because I think that's what you wanted me to finish on. You won't be surprised that I've put there number 1 is we can't do this without listening to the young people first and foremost. We do need to consult and listen to what will make a difference for them. The whole family approach has really, really made a difference in England, and I think if it's something that you feel would work in Ontario, I'm more than happy to share more about how we developed it and went along. It's not rocket science. If you're caring for somebody in your family, then the model needs to be supporting that whole family to remain stable together in a loving way where the caring is not impacting on the children. To be able to develop, to raise awareness, but to also to be developed skills base across health, social care, schools, and working together. Without working together, and it's great that there are people from so many different organisations and fields of work today, it wouldn't happen. It took us a long time to build that energy in England to work together. But I guess my parting message is to never forget that these are children first and foremost, and we need to recognise that they're amazing children and young people they are, and we just need to make sure that they're enabled to thrive and achieve their aspirations. At this point, I was going to ask you to join me to watch the video about the Young Carers Festival, which is about 3 minutes long. Have we got time to still do that? I just think because, it's quite intense talking about these issues, but I just want you to see them at play and how they got their voice. So this was in 2014, so it's the old one, it's not the new one. This is their story of their journey. You'll recognise somebody in there as well. So, okay, so
Celebrating our amazing journey.
Be who you are, because you can get loads of support and it's fine being who you are.
We'd like to have our voices heard about how we think that the people who we look after should be looked after.
We now declare YCF 14 open!
Hello, YCF 2014!
It's been totally awesome. 15, bigger, better, just gets greater each year. It's brilliant. The young people have been absolutely amazing. Given me so much information to take back to government. Outstanding. Brilliant.
Because I think they're amazing young people. They work incredibly hard and they're always really polite and really grateful, and I think what we do is really important.
It's taken a long time, but our voices have changed the law.
The Care Act now says that when they assess the person needing care, that enough support must be put into the family home so that children that are young carers can get on with their lives, they can get on at school, they can achieve, so they can still love and care for the person at the level that they can cope with, but they shouldn't be missing school or missing their life chances to do it.
I really want to strive and get to uni, and a couple of years ago I didn't think I could get that far.
So that everybody get their voices heard and we get treated equally.
Some of the best moments of my life have been with young carers.
They're amazing young people.
The young people just change and come alive.
I love coming here, meeting everyone and just socialising with people that have or are in the same situation as me.
It's our getaway. It's nice because I know that Young Carers is a family away from home.
Young carers are about the most reliable people I know.
I think what we do is really important.
Our group is a massive family. We're all there for each other. Without my care group, well, without any care groups, it would be such a struggle.
You wouldn't have any idea that anyone else was going through exactly the same thing that you are.
It's taken the government 15 years to realise who we are.
It's not about the destination, it's about the journey.
Our journey, my future.
My future is what I choose to make it. I love the YCF. I love the festival.
Why can't it be longer?
15 years of the Young Carers Festival and a lifetime of caring.
And the journey starts here.
Thank you.
In the session that follows, I'm going to ask Janet now to just take a few minutes to talk about the Ontario scene, which unfortunately doesn't look like what we just saw, but that's an aspirational goal for us.
Yes, just because we're not equal to others doesn't mean we can't have aspirations. So thanks to Abigail and to Jenny for setting the stage for the why. I'm here to be able to talk about this has been heard. And so don't be hopeless. There is always hope. So let me tell you a little bit about what's going on. So first of all, in May 2015, there was an initiative where we attempted to look at what we need to do in home care support. And in that review, it became clear that we needed to enhance our caregiver supports. They didn't describe what they meant by caregiver supports, but they noticed that if we were going to provide more care in the home, we needed to focus on caregivers of all ages and of all stages. And it wasn't that we didn't look at caregivers. We looked at caregivers, but we looked at them either by their disease or by their age or by some other definition, their state of health. And this created a matrix with huge gaps, as you can see. So it wasn't that Ontario was ignoring the caregiver, it was that it was being looked at in a uncoordinated fashion. And uncoordinated fashions or non-coordination does not lead to legislative changes. And what we've heard over and over again is we need to get legislative changes and a system working to help us. So the question was, how do we close these gaps? What should we do? So I was so privileged to be asked by the minister if I would provide some advice on how we could coordinate closing those gaps. So it was a great honor to be asked and a great responsibility. So I thought, how do I actually undertake this task? So we did some focus groups. We talked to a lot of providers. I won't say we talked to everyone. We did not. We did not include every single area. But I can say that in some research methodologies, when you start to acquire enough information, you have enough information to act. And so what we saw was clearly no one organization, independent of your age, your stage, your illness, or where you lived, no one organization had their eye on you and could speak for you. So the recommendation made to the minister was that we should create a caregiver organization, one that would be independent of any prerequisites to be part of it, and one that would have a voice that could go across, not just health, because Ministry of Youth and Social Services, Ministry of Education, the Treasury, everyone's affected by caregiving, and young caregivers in particular need to have MICES in schools at play. So what we said was we wanted to have an organization, and it needed to be composed with one point of access. So the report was prepared and submitted, and the deputy called me and he said, Janet, I'm not sure I've got the full report. It only has 3 recommendations. So I said to him, Bob, I need you to focus on getting it done. 3 recommendations will keep you from thinking that there's a lot of things we have to do and being overwhelmed. Let's create the organization, let's get going, and it won't be perfect when we start, but we're going to get close to perfect as we go along because we've got a great team of committed people. So what we did was we said caregiving is a partnership. Because you saw all those organizations that currently exist and care for the caregiver, we're not going to say to them, you don't do it anymore because we've got an organization that's going to do it. So if you look at One Line with Alzheimer's, what a great system they have. A family doctor sees that you're diagnosed with Alzheimer's, connects you up with the Alzheimer's Association. If there's an office in your region, and if you have a primary care physician. So a great idea, but 2 ifs in there. So what we said is we really need partnerships with all the existing organizations that look at caregiving, and we need to partner with caregivers so that we create an organization that responds in 3 different levels. It has to respond at the individual level, it has to respond at the organizational level, and it has to respond at the system level. And all of these things have been covered when both Abigail and Jenny spoke. So when we first talk about the individual level, this was so very important. What we heard was, give us a warm handoff. They said, do not create any individual support that requires me to press a button to get more information and always return to the main menu with this press of the star button. If you want to make me insane as an individual caregiver, add more buttons for me to press. So they said, it has to have a warm handoff. And it has to provide me with resources and communication. And this is not to take away from all the other supports that could be in place, but it has to be to help the caregiver understand what resources are available. Because in some of our focus groups, we would have one family member saying, oh, well, all these things are available. And the person sitting at the table next to him who didn't know them said, I didn't know those resources were available. And then one person said, oh, hospice is absolutely stunning. You wouldn't believe how great it is. We don't need to focus on that. And somebody else said, I couldn't find hospice. And so we saw that the level of knowledge, the level of awareness was so inconsistent. So at the individual level, it has to be a warm handoff. It has to be human. It has to reach out and make certain that we're looking at how do we help you access information. In some instances, how to navigate some of the information. And by navigate, I mean complete some of the forms. Because some of the forms, if you complete them one way, you're going to get support. And if you complete them another way, you won't get support, but you need the support. So how do we help you navigate actively, navigate passively, and how do we facilitate things? So on the individual level, very, very important we help the individual. Organizationally, we have to start addressing the larger gaps that you saw in that first matrix. So if we are a caregiver organization and we see that palliative care is superb in the Sudbury region, but it's non-existent in the West, how do we then use what already exists and say, how do we take that model and expand it? Not recreate it, not redo it. Get away from the 14 LHINs wanting to recreate their own, but in actual fact, augment those systems that exist out there, and we can actually learn from one another. How do we close those great gaps? How do we learn from one another, and how do we partner to make that happen? We also need to look at how do we reduce the silos, because right now people are competing to be the caregiver support of choice, but they actually are competing and not providing sufficient supports. So silos, duplication, and not working together. So the purpose of this organization would be really to look at how do we help some of those organizational issues. And then at the system level, we have to focus on public education and awareness. We've heard about how important that is from Abbigail to be acknowledged at the school. We heard from Jenny the value that people felt when they actually went to a camp. So how do we make caregiving something that's not just about the burden of caregiving? Caregivers said to us, you're using the term burden. It's actually not a burden. I absolutely enjoy caring for my mother, father, sister, but I need more support when I need a break. But please don't call it a burden. It's not a burden for me. It's an opportunity, but I still need some supports. So really, how do we create public awareness on where we need to help, why we need to help, and what it means? We need to increase the knowledge of the service providers. So what can you imagine if every healthcare professional, every education program, so if you're at all the universities and community colleges, you could have a session with caregivers about caregivers, with caregivers about caregivers. So you're teaching your teachers, you're teaching your future lawmakers, you're teaching your future physicians, nurses, social workers, OT, so that understanding the component of the caregiver is a part of your education. This is something we think we can work on. We want to look at legislation. So wonderful examples of how legislation can assist us. So right now we have some initiatives that provided for tax credits. But what happens if you actually don't have an income? A tax credit doesn't actually help you. But is there something we can be doing for caregivers who have just spent 3 or 4 or 5 years and now they no longer are a caregiver because of the death of the person they're looking after or because of a change of circumstance? What about prior learning assessment? What about unemployment insurance? What about educational grants? What do we need to do to support from a policy perspective? And only caregivers can tell us what is important from a policy perspective. When you view caregiving on the outside looking in, you think you know what it's all about. But when you sit in the presence of a caregiver or when you actually find yourself in the situation of being a caregiver, you understand deeply what those policies, procedures, and legislative changes need to be. And we wanted to actually take a good look at caregiver research, because I'm not sure if you're aware, but everybody wants to study the caregiver right now. The caregiver could have a full-time job answering all of the studies that are being conducted. PhD students, professors looking at it, social sciences, health, finance, everybody wants to study it. So we need to make certain we're asking the right questions in the right way and using a collaborative approach so that when we do study what is needed and when we do understand what's needed, we've done it in a way that highly respects the individuals who already have an extra activity in their lives, caregiving. And when we ask them to complete a 30-page survey, saw it? A 30-page survey, what are we doing? Is that in their needs, best needs, or is that in our best needs? So really giving the organization a focus on how they could help coordinate research and giving us a broader understanding so that we're working for the caregivers, not working at the caregivers. So those are the examples of the 3 areas, individual, system, and organization, that we wanted to look at. So what do we know? So it would be great if I could just import the UK system, but I cannot. That hasn't been done by Spock yet or anybody else, so can't do that. It is going to have to evolve over time. It's going to have to be something that is for caregivers, but not on the backs of caregivers. And we won't get this right the first time. Like, we'll engage caregivers and we may engage them too much and they'll say it's too much or not enough and they'll want more. We need to understand that we're moving forward together to try and make this happen. And we want to make certain that we include all caregivers. So some groups were much more vocal than others. So the French language caregivers wanted to be heard. The First Nations, Métis and Inuit wanted to be heard. The LGBTQ group wanted to be heard. Young carers didn't come out and say, let me be heard. But we need to make certain that in paying attention to the more vocal segmented groups, we don't ignore the less vocal segmented groups because they're too busy caregiving. So we really need to make certain that as we expand the organization, it will all evolve over time, not on the backs of caregivers, and that we take into account special needs in an informed way, not just on a loudest voice way. So we want to focus on partnering with others. I've talked about that, but I can't emphasize enough. If we start this organization and we do not partner, we will be undermined all along. So we've got to make certain that we're building in everyone's awareness and support, and we have to be cost effective because people will view there's only so much money in the pot. And if this organization is created and takes away from others who give, there'll be resentment. So we need to be together. We need to be cost effective. So we're proposing a model that will be a centralized organization with a distributed model using self-help grouping, much like a bereaved family grouping. So those are moms who have lost a child through death, help other moms who have lost a child through death. But it's all with the support of a paid staff. You might be looking at caregivers doing self-help at all ages, at all stages. So really looking at a distributed model with a lot of self-help, volunteers who want to be engaged. I had a delightful gentleman speak to me and he said, Janet, how are you going to use me in the future? I said, well, what do I need to know about you in order to know how to use you? He said, well, I supported my mother with Alzheimer's and now I'm supporting my wife. And I'd like to know how you can use me. Well, there's a perfect person to help with navigation of the system, perfect person to stop and say, I know how it feels, perfect person to sort of reach out and assist. And he said, yes, that's how I'd like to be used. And I'd like to help us change legislation. So I've gone through very quickly. I'm very excited about the commitment of this government to creating a caregiver organization. I'm exceedingly excited about what we can learn from the UK so we don't have to recreate things but can draw from them and learn from them. I'm thrilled that young carers are meeting today and tomorrow so that we can learn from you as well. The next steps are agreement on how we will proceed with this recruitment of a board of directors who will be skills-based but caregiver-based. So you have to be a caregiver but also have skills in finance or law or legislation. Advisory groups that are from carers groups, using advisory so you don't pull people out of their homes but finding some new technology ways to get people to participate. And we'll hire a CEO to create a team to develop the platform so that we actually can be a group out speaking and promoting that we have made a difference in the lives of caregivers and to be able to do that sooner rather than later. Thank you.
Thank you very much, Janet. That is very exciting. And certainly we at the Change Foundation have been quietly supporting the notion for almost 3 years now. So to have an announcement and a focus is wonderful. So we do have a few minutes for some questions. Because we have people online, if you wouldn't mind going to the mic, just saying who you are, and if it's anybody in particular you'd like to answer the question, or all three. Starting at the back with our newly minted board member, Golda.
Hi, I'm Golda Milo-Manson, developmental pediatrician at Holland Bloorview here in Toronto. This question, or maybe it's just clarification, Janet, if I heard you correctly, you're talking about the governance that you would have in this organization, and you're talking about having someone with financial background and someone with perhaps a legal background. I didn't hear anything about having youth on your committee. I don't think you can plan and govern without having co-development and co-governance.
So the inaugural board will need to be, they will have to have had a caregiver experience. So we will make certain that's a baseline. But to add to that, when you inaugurate or get a board up and running, you need to make certain that they're able to provide the fiduciary oversight. We will support that with advisory committees, which may be by youth or by illness. We're not sure how those advisory committees should be structured. And then as the board evolves, you'll be able to move into having a caregiver on the committee. But we need to walk before we can run. And
I would challenge you that you have an incredible opportunity here, because you're starting from the ground up, and take advantage of the wonderful and experienced caregivers that are in the community.
Thank you.
Other questions? Yes, at the back there.
Hi, I'm Holly Mathers from the Young Carers Project in Waterloo Region. My question's for Jenny. I wondered if you could just comment about the relationship between the SIBS UK organization and then the Young Carers movement.
Okay. Thanks. Yes, so we do have quite a lot of SIBS support systems in the UK, and they grew up recognising that there was a need to be there for the brothers and sisters as well. So often families couldn't take all the children out, particularly if the child had particularly demanding special needs. So originally the SIBS system was, SIBS support groups were there to give those siblings a break, and they were not necessarily all young carers. More recently, they've all started working together, and they are supporting young carers of siblings as well. So it's been a bit of an evolution. So some of the SIBS groups have been around a long time. So they too do recognise young carers. In fact, I can't remember if I said it at the beginning, but the first piece of work that I did was commissioned because a social worker in our locality had recognised that there was a lot of focus in the family, understandably, on the child with the disability or the additional needs, sometimes at the cost of the brothers or sisters not getting the attention. This is not a criticism, it's just reality. There wasn't time to give attention to the other brothers and sisters, and so that's why that first piece of research was commissioned.
I'm going to hog the mic for a minute because, Jenny, there's something you said, and it was just a sentence in your presentation, but it's been in the back of my mind since, which was that you had a group of young carers meet with the chief executive of the NHS, which in our parlance would be the deputy minister of health. So I'm wondering how that went, and if we were going to engage Abigail and some of her peers in a meeting with Bob Bell, what you would suggest as a structure for the meeting.
You really want to know?
Yes, I really want to know.
Okay, well, it was led by the young people, so here we go. So the young people said they wanted to meet with the chief exec. They looked up, found who he was. We were supported by staff in NHS Improving Quality team that we work very closely with on some of our initiatives. The young people were very clear that it was to be no suits. So they didn't want people sitting around at tables with paper and suits. They wanted something that would be interactive, and that where they would have a voice and they wanted to lead it. And so we skilled the young people. They didn't need much skilling, I can tell you. They were just so good at public speaking and saying what they wanted. And we said, what do you want? We asked them what they wanted to get out of the meeting, and they said, we want some pledges. I don't know if you know this in Canada. I don't know if this is something you know. It was a learning curve for me. And we said, what sort of pledges? And they said, pinky pledges, because you can't break them once they're made. Do you know what a pinky pledge is? Yeah. Yeah. So they actually went to the people in the room, and when they had said they were doing, they actually got them to do a pinky pledge, and those pinky pledges have been followed up by NHS Improving Quality to put them in place. So it was, a young people-led, driven meeting, and what's happened is that Chief Executive has remained involved and has wanted updates because it's a meeting he can't forget.
Right, thank you.
So there you go.
No, that's okay. So Ministry of Health people who are watching. Other questions? Oh, sorry. Yes, Tony.
Tony Woolgar. Firstly, tremendously encouraging but challenging messages. Very heartening, Jenny, to see what's happened in the UK and in England particularly. But I just wanted to ask each of you the same question. Where would you like it to be in 12 months' time? So Abigail, from your perspective, you've shared with us a brilliant and an amazing story. What would you want to see differently 12 months from now? Jenny, what do you think the most important change would be for us in Ontario to see in 12 months? And Janet, what are you going to hold Bob Bell to account for in 12 months?
Abigail, are you okay to answer that one? Yeah, okay. Okay, why don't we start with Janet and we'll come this way.
Okay, so I'll feel that Bob Bell listened, and I do believe he's had life experiences, which we've all heard about, so he understands the role of the caregiver. There will be a caregiver organization created. There will be a full-time CEO. There will be an office that has already established its website and a hotline in terms of when you dial the number, a real person answers it, and that we have the beginning of the distributed models out in each of the 14 areas. It won't be accountable through the LINs, but it will be located or proximal to the LINs. That's what I would hope we would have in place in 12 months.
Wow. Jenny?
Well, you won't be surprised to hear me. I think that I would like to see in 12 months a system, whichever one works for you, which is giving the young people a key voice. So Abigail's had a voice, but there must be thousands out there that don't have a voice. So a mechanism for making sure that they have a voice and that they're heard, either through the board that you're having or having their own coming together like tomorrow so that they get heard, but also to keep asking yourselves the question, why are they caring and what needs to change?
You ready? Yeah, okay. Say that? Yeah, it's fine.
And I'd like to see in 12 months, more organizations like Powerhouse and more support and things like that.
Very reasonable, I'd say. Other questions? There's a baby in here. This is so cool.
Hi there, Danielle Van Duzer. Just wanted to thank Abigail for sharing your story. That's really powerful. I know that's not always easy to share that sort of personal story, so thank you. I wonder for all of us in the audience, if the panel could comment on, if we went back to the office tomorrow, what are 1, 2, 3 things that we could do to start putting some of this into action?
Janet, I'm going to start with you again, if you're okay.
So I fortunately had an experience about 6 years ago where a young mom came back to work after having been off, having had her second child, and she was frequently absent. And so I sat with her and said, and her colleagues were beginning to question this, so I sat with her and I said, I just have made note that you've got some frequent absences, so is there something I need to know to support you differently? And we discovered she had a child with multiple challenges and that she needed support in caregiving. And we talked about the plan that we could put in place for her to engage her colleagues so that they were supportive as opposed to questioning. And she put that plan into place with a one-on-one meeting and then a group discussion, and the difference was phenomenal. Nobody ever said, where's X? They would just say, oh, I don't think she's here this morning. I think such and such has an appointment. Oh, yes, it does, and we're all hopeful that that goes well. And so we became a team of support. But I think we don't always ask that question at the office when someone's absent or shows up late. We don't ask, where do you suppose they are? We just make our own little assumptions. So have the conversation and be open to what you'll hear.
I think the most valuable thing would to be go back and think about the client group that you work with, or the systems that you're working with that support the client group, and how does that include caregivers? So are you reaching out? Is there enough information out there so that they know that they can ask for help and support when they need it? Because if it's not there, they might not know where to go. And to think what you might need to change in your information and sharing, and if that might also involve partnering with other organisations to achieve a cohesive, joined-up approach.
I'm going to alter the wording slightly for Abigail and just say, given that you spend most of your day at school, is there one thing the school could do to change that would be helpful to you? Anything you can think of? No? Making more groups at school, yeah. And this idea, I loved your example of changing the time that the group meets so that you can participate rather than convenience of teachers after school. Great.
Thank you.
We have, yes, just 3 minutes. Okay, yes, Joanne.
Hi, thank you so much to the three of you. Certainly, I'm Joanne Sidorchuk from the Changing Care Project Embrace at a Cornwall hospital. We certainly heard the importance of starting with the voice of the carers. I'd ask the three of you, where do we find the carers? We know from some work we've been doing with the older carers, it's really been word of mouth. We can put posters up, nobody really calls, ads in the paper, but how do we find young carers? And also, how do young carers want to communicate with us to tell their stories?
Okay. Janet?
Great question. I don't know that I know how to find the young carers other than when we talk about public awareness. Wouldn't it be ideal that if every primary care physician, nurse practitioner, social worker, teacher always had in the back of their minds, is this child I'm with looking after other responsibilities as well? Are they caring for someone else in the home? So that we leave that, just as we wonder, did they get breakfast this morning? Do they have a safe home to go home to? Are they safe physically themselves? If we all stop to say, is there someone else in this person's life that may require their attention? I think that's our first way, and then to start the conversation.
Any advice?
Yeah, I think there's two key things. I think when practitioners are going into the family home or meeting with the family, with the person that has the illness or the disability, that they should always be mindful if there are children in the family home and asking the question of themselves and also phrasing it for the family if their child might be helping to care, or how does the daily family life impact on their child, and is there anything that could be offered to improve that support, and equally do the children, would they like to talk or communicate? I think so many young carers said that they were never spoken to when social workers came to the home. They were there, it was very obvious, but they were just ignored. And I think the other key one, and it's not easy, is schools are absolutely crucial. I think if pupils are late for school, not achieving, and that doesn't mean really doing badly, but they might be getting C's instead of B's, and you know that they're capable of it. And just making sure that there are systems in place. Groups in schools are wonderful, because if there's a young carers group and it's advertised as a young carers group, young carers will suddenly realise, that's me, and maybe I should go along and find out more about it. So having a resource there, might not that you'll get a full house the first few weeks, but gradually you will start to identify them.
So Abigail, if we wanted to find more Abigails, where would we find them, do you think? In the Tim Hortons? No, not in the Tim Hortons. Where would we find them? Do you think at school?
Yeah.
Yeah.
At school.
Makes sense. Yeah.
Yeah.
Yes.
We're talking about disclosure and how you ask and you seek. We have to remember that young carers who are caring for others with alcohol addiction or mental health issues still carry a stigma. And I'm old enough to remember when cancer carried the stigma. You know, cancer can be beaten was the big push in the 60s and 70s because it was a stigma nobody wanted. We have got to change the stigma of mental health, alcoholism, and addiction.
So I think I will bring this to a close. Please do stay and join us for a little reception. Our speakers will be here, happy to talk to you further. We do have small gifts of appreciation for, in Jenny and Janet's case, it's a donation to a charity that they asked for. In terms of Abigail's case, her mom asked if they could go to the aquarium. So when we called the aquarium to get tickets, they got donated because they read the story in the Globe. So we hope you enjoy the aquarium. Thank you very much, and please do stay around and continue the conversation.